On average, we've seen consistent with the clinical trial results, $7,000 to $10,000 of cost savings per patient compared to when they don't get the multidisciplinary support that we can provide. A lot of that comes from avoiding the ER escalations. We've seen stats that showed that GI patients are the number one driver of treat and release ER visits. Where they go in, they're worked up. Often it's the imaging that happens there, CT scan. That's all racking up costs to the purchaser just to have it released with no intervention given. And so those are the avoidable episodes that really we can prevent. Not in every case, right? We make sure that we just had a patient a couple of weeks ago that had a pretty serious need to be in an ER. We were able to coordinate that. We didn't mention it, but we have care coordinators. It's a big part of our staff. And it is to make sure that when our patient has that local need, that we help them get in. And, Treta can hop on the phone with an emergency room doctor and explain what we've seen and what we think is happening. Or with a local gastroenterologist. That's how we drive the cost savings. And again, they're published now. We've had papers at ACG on the presidential poster showing the cost savings, really creating value for local GIs too, if their patient stays out of the emergency room and is doing well. And we're always sure to make sure that the patient understands who referred that patient over to us, right? That was great that they did that. It strengthens that relationship with the local GI.